Hi, everyone. Thank you so much for joining. Hope everything is okay there at SAFE, if that's where you all are at. I am happy to be introducing this webinar. I am Lynn Michaelopoulos. I am the just newly with USAID as the resilience measure, the resilience M&E advisor with the Bureau of Food Security. And so I want to just give a very brief background, and then I'll introduce Jill Scantlin and Tim Frankenberger so we can really dig into the meat of this webinar. So this webinar will provide you with an overview of Guidance Note 6, which is on recurrent monitoring surveys, and really going to be focusing on the design and implementation side of that. So this guidance note is a part of the USAID Resilience Measurement Practical Guidance Note series, which really aims to provide innovative and insightful ways of assessing, analyzing, monitoring, and evaluating resilience as a part of the REAL Award, or the Resilience Evaluation Analysis and Learning Award. So recurrent monitoring surveys was really born out of PRIME, which is in Ethiopia, implemented by Mercy Corps, and it's the Pastoralist Areas Resilience Improvement and Market Expansion Project. So when we think about just an overview of recurrent monitoring surveys and kind of what is it, it's really, it's all in the name. So it's ongoing multiple rounds of data collection with the same household, so using panel data. We think specifically within the resilience world, resilience framework, RMS allows us to understand in real time how people's resilience capacities and all of their coping strategies in relation to a specific shock or stressor actually impact the well-being outcomes or what realized resilience. And these outcomes can be health or poverty or food security. So there are a different number of outcomes that we can look at. So if we think about the value of RMS, it's real time. We're able to look at ongoing data collection points and in response to a shock. So with that, I'm going to turn it over to Jill Scantlin. And if I could just have a reminder to everyone, if you could please pose questions within the Q&A box, I will keep a tab on that. And then we can, and then I'll come back on during the Q&A after Jill and Tim do their presentations. If there are any, so if you put your questions there, then we'll go from there. Thank you so much. Jill?
All right, thank you, Lynn. I just want to make sure that everyone can hear me. Maybe just one person in the chat or many people. Let me know if you can hear me. All right, thank you so much. All right, so apologies for no video, and you're just seeing kind of a black box here. It's not working on my computer. So hopefully that's okay for everyone. Yeah, thank you all for joining this webinar. This is really exciting. This is about, a year's worth of work putting this guidance note together. So I'm excited to share it with all of you today. So what we're going to do is we're going to give a broad overview of what's covered in the guidance note 6. It's not going to be a line by line. I would suggest reading the guidance note for that, but really just trying to give you sort of like a taste of what's in it. And then we're going to dive a bit deeper into some recurrent monitoring survey case studies, starting with Nepal, which I will be going into, and then I'm going to hand things over to my colleague Tim to then get into a couple more case studies. And yes, now let's do the poll. I think on the next slide, we have a poll that is going to ask you whether you have read this guidance note. Lynn, let's see. I'm not sure where the poll is or if that's going to be coming up.
We lost the slides there. I don't know what happened.
Now we've lost the presentation.
Yeah.
Well, Tim, maybe improvise something here until it comes back.
Yeah, we want to know how many people actually read the guidance note 6.
So maybe in the chat box you can put whether you have read it yet. I have a couple of no's, one yes. Okay, a couple more yeses. Seems like more no's than yeses so far.
Okay.
I'm wondering, Tim, if they had to leave the building because of this fire situation. I don't know. Tom, are you on? It looks like you're on.
Can somebody control the presentation from that end?
Everyone had to leave the building and save. Oh my goodness.
That's a first.
This is an unprecedented technical difficulty.
Fire in the save building.
Okay. Well, let's see. What should we do?
Well, do you have the slides on your computer?
Yeah, I don't know if I can project them though.
Oh, I can't either.
Hmm.
Well, there's a slide there now.
Let's see, share. Maybe I can share my screen. Let's try that. Sorry, everybody. This is really... Can you see my screen?
I can.
You can? Okay. Maybe let's do it this way.
Okay.
Okay. So we're gonna just try to do it this way and see if it's working. So everyone else can see my screen?
I see it.
Great. I'm gonna make sure the chat... I can't see the chat box. So Tim, are people saying they can see the screen in the chat box?
Yep.
Okay, let's keep going. Alrighty, so what I'm going to do is I'm going to give sort of a brief overview of the guidance note, and then we're going to dig into some case studies. So this guidance note is primarily based on Mercy Corps and Tango International's experience with designing and implementing recurrent monitoring surveys in multi-year programs focused on building resilience to shocks and stresses in multiple contexts. So really just to emphasize that the guidance note is sort of, you know, drawing on this collective experience to provide some practical guidance to implementers on the considerations for determining whether to actually invest in a recurrent monitoring survey in your program. We also give a broad overview of the two main recurrent monitoring models that we use with some illustrative examples. We also give some pretty detailed methodological considerations for setting up and implementing the recurrent monitoring survey. And then we also try to add some additional practical information on how to plan and budget for these recurrent monitoring surveys. So in the guidance note, because we wanted to make it very practical and useful for development professionals and implementers, we really honed in on focusing on how to communicate what a recurrent monitoring survey is and how it's different from typical program monitoring. As I've already mentioned, we really get into some of the key considerations for designing and implementing an RMS. And then we try to weave in wherever possible those insights into what worked well, what challenges emerged, and what solutions were developed when implementing recurrent monitoring surveys and trying to draw on multiple country and project contexts. So what the guidance note doesn't cover, or what it doesn't do, it's not a step-by-step process or protocol for conducting a recurrent monitoring survey. So it gives you those key considerations and things to think about when you're designing it, but it doesn't tell you exactly step-by-step how to do it. It also doesn't really get into analysis of recurrent monitoring survey data. It's primarily focused on the design and how you set it up. Whenever possible, though, when we found areas where we weren't able to go into more detail, we tried to provide resources and links to other sources so that you could follow up on those areas on your own. All right, so now I'm going to get into the content note guidance in more detail. And really the first thing to talk about, I think, is, discussing, so what's the difference between recurrent monitoring and regular monitoring? What makes it different? So there's some key areas that really distinguish it from regular monitoring. First of all, around data collection, the main difference is that you collect data around when different shocks or stresses are happening. And this is either triggered, the data collection is either triggered when the shock happens, or you give it at certain times of the year when shocks and stresses are more likely to happen. This is different from regular monitoring in that regular monitoring follows, your program cycle and reporting cycle. And sometimes those two things don't really match up when shocks and stresses happen and when you're supposed to be reporting. So the main difference here is that with recurrent monitoring, you're trying to collect data before and then shortly after that shock happens to see how people are responding. We also rely on panel data for recurrent monitoring surveys. So, following the same households over time. This is different from most regular monitoring activities where you would collect the data again around these reporting cycles, or perhaps to monitor a specific activity. Now, it's also different when you're thinking about how you're using the information from a recurrent monitoring survey. With recurrent monitoring surveys, the data is often used to test the theory of change. So hopefully you've already set up your resilience-focused theory of change. If not, the 5th guidance note gets into how to do that. But the data that you collect through recurrent monitoring survey allows you to sort of test those relationships between resilience capacities, how people are drawing on those capacities to address shocks and stresses, and then what are the effects on long-term or short-term well-being outcomes. Recurrent monitoring surveys also allow you to evaluate the impact of interventions, and I'll go into that a little bit more in the next couple of slides. That's a bit different from just regular program monitoring, which kind of is more focused on those, monitoring of the project level activities. It doesn't really give you that higher level information about the impact of interventions. You can also use data for recurrent monitoring survey for a crisis modifier. So this is something that you can embed within the design of your recurrent monitoring system that allows you to be able to use information to decide whether a humanitarian response is needed. And it will allow you to be able to kind of respond to that in a more timely manner because you're using the information specifically for that purpose. Of course, you need to sort of set this up front in the beginning and have these contingency plans in place before you start, but it does give you that opportunity. And that's something that maybe Tim will go a bit more into during his presentation. And so the things that really make a recurrent monitoring survey different from regular program monitoring also make it a really valuable tool for your program and for understanding resilience and whether you're building it. So the ability to test a theory of change allows the recurrent monitoring survey results to provide insights into those underlying dynamics and relationships between the resilience capacities, the use of those capacities, and the effect those have on outcomes. You're also, if you're able to then combine or embed an impact evaluation into your recurrent monitoring survey, this is great because it allows you to kind of test those different intervention packages and see what the effect is on well-being outcomes, and allows you to sort of track those over time, especially if you're collecting data frequently from the same people over time. And then, of course, because the recurrent monitoring survey data is collected more frequently, there's a great opportunity to use that information to make management decisions and for adaptive management because you are collecting it in real time. And you're able to get that information as the program is going on. So let's get into this diagram here. So when setting up your recurrent monitoring survey, the main consideration for how you're supposed to set it up, what model you need to use, is really the shock and stress context in which your program is operating. And so within the guidance note, we consider 2 main characteristics of shocks and stresses that will have an effect on the design and implementation of the recurrent monitoring survey. So the first consideration is whether the onset of the shock or stress happens fairly quickly. So is it acute? or more slowly? So is it more of a chronic stress? So this being able to, I guess, having a more chronic or slower onset allows you to sort of anticipate the shock or stress, perhaps more so than one that comes on very quickly. And so this will kind of determine the level in which you can plan beforehand for your recurrent monitoring survey. So the second characteristic of a shock and stress is whether it affects a lot of people over a large geographic area, this is what we consider a large covariate shock or stress, or maybe it's something that's more isolated to certain households or communities, and that's what we would consider an idiosyncratic shock or stress. Now, whether it affects a lot of people or a few people, this really determines kind of your sampling strategy that you're going to use. If it's a large covariate shock, you might have a better time using a population-based sample because everybody in the community is experiencing it. If it's a couple of people that are, living close to the river, perhaps if it's a flooding example, and maybe the people in the hilly areas aren't experiencing that flood, you're going to have to sort of be a little bit smarter about your sampling strategy and think about that a bit differently. Just wanting to note that, this is, looks nice here. The earthquake falls neatly in the acute rapid onset, large population affected shock, but a lot of times shocks and stresses don't really fit nicely into a box, right? And so there's multiple shocks and stresses happening at once. And often they kind of start off in one box and they might migrate to another. And so it's very possible that things in practice don't happen this nicely. So I would just say what this really helps, the way that we frame this, it just sort of helps you think through the questions that you need to be asking yourself when you're setting up your recurrent monitoring system. It just sort of allows you to kind of think through some of these sampling challenges and timing challenges of when you would be able to give the surveys. All right, so let's dig into the different recurrent monitoring survey models. So the first model that we rely on, or that a lot of our programs have implemented, is when the shock or stress triggers the RMS. And so this works a lot better when you have a shock that affects a lot of people. So say like an earthquake or a drought. So the recurrent monitoring survey rounds are really triggered by this pre-specified shock or stress threshold. So you want to identify that in advance. You want to be able to have measures of that exposure and severity. So how many people are actually experiencing that shock and to what severity. And you'll need to have a system in place, either through secondary data or maybe you're collecting yourself, to monitor those shocks and stresses routinely over time. So with this model, you would want to do a comprehensive baseline prior to the shock. And then once that sort of shock threshold is triggered, you would then have multiple rounds of surveys. Potentially the surveys are going to be shorter. Hopefully they'll be quite a bit shorter than the baseline. And you might even follow up with a smaller group of people over time. And so this application is something that the Prime project in Ethiopia implemented. And so this is an example that Tim is going to go into more detail. So I won't go into a lot more here. I'll save that for Tim. So the second model for recurrent monitoring surveys is a bit different. So we've really designed this one around for the shock and stress context where you have these seasonal or idiosyncratic shocks are more common. So in this case, rather than being triggered by a shock or stress itself, you set up the surveys so that you're collecting them at regular intervals when shocks and stresses typically happen. So in the case of Nepal, which is the example I'll be getting into, there's lean seasons in the year and the monsoon season. Those are the 2 times of year where most households are experiencing quite a few shocks and stresses. So we set up our survey rounds around these seasons to see how people are using capacities to sort of address how are they drawing on these things to address those shocks and stresses. And so the strength of this model is that it really helps to capture those idiosyncratic circumstances of the household. It also allows you to track the contribution of activities. I think it's more conducive for tracking those activities and how they contribute to the household's resilience over time, since they sort of happen at these more regular intervals. It's also a bit easier to plan for this model ahead of time, which can be more helpful for budgeting purposes. And then again, like adaptive management, I think the first model, you can use the data for adaptive management as well, but because the survey rounds are a bit more spread out, you might have more time to be actually, to be able to reflect on the data that you're using to make those management decisions. So the case study that I'm going to be digging into here relied on that second model, a recurrent monitoring model, where we set up the recurrent monitoring system around the lean and monsoon seasons in Nepal. So this project, so Promoting Agriculture, Health, and Alternative Livelihoods, is a 5-year Food for Peace funded project in the far and Midwest regions of Nepal. We had 3 rounds of quantitative survey data embedded into our annual surveys, and then 3 rounds of qualitative data that complemented the quantitative data. We also did a cost-benefit analysis of activities and the cost of those activities to see what had most value for money within our intervention packages. So one thing to keep in mind about this example is that it was done at the very end of the project when many of the activities were have already finished being implemented. So it's actually more of a post-project evaluation of the integrated approach that Pahal took. So it's a bit different than other recurrent monitoring systems in that way. So for this recurrent monitoring survey example, I wanted to really highlight the way that we embedded the recurrent monitoring survey into the existing annual beneficiary surveys, and what were some of the success factors that led us to be able to do that, because it is quite difficult to be able to do that. So first of all, we mapped our resilience indicators to the existing indicators that needed to be collected through these annual surveys to determine what additional questions would need to be added to the annual survey. So we really tried to see what data was already being collected that we could attribute to capacities before adding additional questions. We also did things like changing recall periods. I know the annual surveys have a 12-month recall period. We then had to sort of shorten those to 3 months. Little changes like that actually make quite a bit of difference. We also made the case to follow the same households over time and got approval from USAID to change the sampling protocol. And this really allowed us to shift that panel data collection model. We also made use of the beneficiary database and leveraged that to identify the different intervention packages. Now, I can't really emphasize this enough, but setting up a robust beneficiary tracking system where you're able to give unique IDs to individuals and households, and even tag different communities through this beneficiary database is very important for tracking sort of who is participating in what intervention and to what extent. And that really allows you to embed that impact evaluation component into the recurrent monitoring survey. It also allowed us to link that beneficiary data to the activity data and the cost data, which gave us the ability to do the cost analysis. And so just briefly, because I know I'm kind of running out of time here, just what did we find through our recurrent monitoring survey and evaluation? So we were able to show that all combinations of Pahal interventions were really strongly related to these positive resilience responses. So things like drawing on formal loans to respond to a shock or stress. And the strongest effects we found were in our full integrated group. So this was really helpful for sort of validating the intervention approach. We also found that the full integration households reported are feeling less vulnerable to shocks and stresses. This is a surprising finding because we often, through our surveys and our qualitative data, found that people were pretty pessimistic about their ability to face shocks and stresses. So it was pretty it was great to see that at least among households that received these multiple integrated interventions were feeling less vulnerable over time to shocks and stresses. We also found, interestingly, that these full integration households were more confident that they could access government services, but also reported they were less reliant on them. So perhaps some sort of proxy for, sustainability of the interventions, that people were able to, say, I feel more confident in my government, but yet I don't need to rely on them. And then finally, in the cost evaluation, we were able to dig in and see what component of this full integration package had the highest returns per dollar spent. So when looking at it from the household perspective, we found that financial service interventions had the highest returns to the households themselves. In contrast, when taking a different view of what's more cost effective for the Nepali government, the water interventions really had the greatest value for their cost. So when thinking about which intervention should we invest in, this cost analysis was a great addition to be able to give us those insights. There should be a report brief on these findings available in the next couple of weeks, and hopefully we can provide a link and follow-up link to that to everybody in case you're interested. So I'm going to stop and see if I can not share my screen. Or actually, Tim, you probably want me to continue sharing my screen, right? Okay.
Continue to share your screen, yeah.
I'm not able to...
Oh, sorry. I was just going to say, as we're switching the screens, there is one question that I think could be fairly quickly
sure.
as
Thank
we're
you.
shifting. Sorry to interrupt you.
No, thank you. Thank you.
A question from Gregory Young of, did you sample any non-intervention households, or did you just compare between households that received different levels of treatment? Oh,
great question. So I would say in an ideal world, it would have been really great to have a pure comparison group. And I would always, if it's feasible, sometimes in certain contexts, it's really not feasible to do that. But whenever feasible, I would say, please do that. In our scenario, we were not able to have a pure comparison group that had received no intervention. And so what we did instead was that we looked at, we compared households that had very little interaction. So sort of like a low intensity scenario where they might have received a couple of the interventions, but they're really not participating very much. And we compared those with households or communities that had very high participation. And so those were sort of our comparison groups. And I think Prime did something similar in their evaluation. And I think there's, it's definitely more feasible to be able to do that, because then you don't have to convince people that don't have any, stake in the program to take your survey, but there's limitations as well. So I hope that answered the question. It looks like somebody else is rolling the presentation now.
Yeah, it looks like Maya's back.
Oh, great.
Yes, we're back.
We'll do additional questions at the end, but I will then hand it over to Tim Franklin.
Hi, everybody. Sorry for the the craziness on the fire alarm in Say, but it didn't stop us, so we're going to continue. My presentation is going to be talking about the PRIME program. This is the Pastoral Resilience Program in lowlands of Ethiopia. We had carried out 2 rounds of the recurrent monitoring there, and so I want to talk a little bit about some of the findings. Next slide, please. Before I do, though, I wanted to know of the people that are listening in, what kind of context are you currently operating in that is suitable for an RMS or not? Are you in places where there's rapid onset large covariant shocks, or slow onset large covariant shocks, or slow onset seasonal climate related shocks? We just want to take a poll real quick. Are people answering the poll? Okay.
Yes, people are still responding. I will project the results very soon. Can you see them?
Okay. All right. So a lot of people are in these slow onset large covariant shock areas like droughts, and they do think it's suitable for setting up an RMS. That's great. And some people aren't quite sure yet. Maybe at the end of our presentation, people will know more. Shall we continue? Next slide. Okay. So in terms of this prime RMS that we set up, it was characterized by three main features. One, that it had real-time data collection after a shock hit, and this was a major drought that hit, so we set up the recurrent monitoring after the drought. We also had high-frequency panel data that was carried out every couple of months. It was a smaller sample from we had a baseline sample, and we drew a smaller sample from that. The baseline was around 2,500 households, and we drew 400 households for the panel data collection for the RMS. One of the things that it did help us do was it informed us whether interventions were building resilience. And what we were measuring resilience by is whether or not people's food security actually was able to be maintained or recovered quickly or was enhanced in the face of shocks and stresses. We also used their own subjective evaluation on whether or not they felt they could manage the shocks and stresses. So we had two measures of the resilience. And the other thing that this recurrent monitoring did was it helped us identify the optimal times to launch an early action. So if things got really bad and we needed some kind of humanitarian response, such as a crisis modifier, the information that we were collecting allowed us to trigger that. But the thing is that an RMS is not a substitute for a baseline, a midline, or an endline. It should be thought of as a complementary design that allows you to kind of track how people respond to shocks in real time. Next slide, please. As you can see, the project started in 2012 and ended in 2017. And we had a baseline, 2 rounds of RMSs and an endline as part of this. And all through that time, you can see the drought conditions got increasingly worse over time. So we were able to manage to watch how households were coping with these significant covariant shocks over time. Next slide, please. Once we were convinced that the shock was occurring, we started collecting data, and this is both quantitative and qualitative. As I said before, we had a quantitative panel subsample, and the survey itself is very short compared to the baseline. It takes about 10 to 15 minutes to collect the data. The reason that we wanted it to be short was we didn't want to bother these households because we were going to be coming back every couple of months. But 2, we already had quite a bit of data on those households because it is panel data, and so we were able to already have the resilience capacity information, a number of other demographic characteristics on those households. So we didn't have to continue to keep asking that question. Next slide, please. So I already talked about the questionnaire. One of the things that's important about these questionnaires is to make sure you have indicators that are sensitive to rapid change. So if you're tracking food security, you want some kind of experiential variable that does change quickly so that you can tell whether or not people are managing or not managing these shocks and stresses. The qualitative data is also key to this, and we want to make sure that we're collecting information from the households and communities to try to get their perspective on what they think is going on and how they're managing, how they're not managing, and what other changes are happening at the community level. Next slide, please. We use growth regressions because we've got multiple data points that we're tracking these households over time, and it allows us to actually see whether or not people are managing or not managing these shocks and stresses. So we're collecting information on shock exposure, their initial food security levels, their household characteristics, and how these change over time. We are also able to identify some households that are positive deviants that actually seem to be doing better than other households in managing these shocks and stresses. So it allows us to get a closer look at what's different about those households and why are they managing better. Next slide. So it did help us identify programmatic areas to focus on when we see future droughts. It has one thing that really came out was timely humanitarian assistance. It's not only whether or not the interventions were working, but the timely humanitarian assistance in terms of when is it appropriate for food aid or cash, how large should that be and how long it should be. All of these are critical for enabling people to protect their assets and your investments. The RMS also indicated which areas we should be focusing on. So building social capital was critical for enabling people to manage these shocks and stresses. These informal safety nets that people, if they have good social capital, they do take care of each other. Maintaining and enhancing household asset bases so that people can use assets to manage these shocks and stresses more effectively. Ensuring people have access to savings and credit. Savings to absorb the shocks, but credit also to diversify their income sources. And increasing access to communal natural resources. How people, collective action on natural resources is critical for managing the shocks and stresses. Next slide. We collected an RMS round 2 every 2 months, and this was when the worst drought in 50 years was hitting this area. We were tracking both satellite imagery data as well as people's own perceptions of what was happening. And it allows us to understand whether interventions are helping households better manage the drought. Next slide, please. One of the things that was critical about this survey was that 40% of the households were in villages that were receiving comprehensive resilience programming, and 60% were not. And so this allowed us to actually see, does comprehensive programming make a difference allowing people to manage these shocks and stresses? And the results that came out of this are a strong statistically significant difference in the relationship between shock exposure and food security between the treatment and control groups. Now, we, as Jill already said, the treatment is high intensity households, those households that are receiving 3 or more major clusters of interventions. And low intensity are households that only receive 1 or none interventions. Next slide. And you can see here, when we look at the trajectory of shock exposure, comparing the low intensity and high intensity households, the high intensity households are doing much better as the shock exposure gets worse in terms of maintaining or increasing or enhancing their food security. Those that have low intensity, we're not seeing a positive outcome. Next slide, please. Same thing for predicted of unplanned cattle and goat deaths. Those households that are receiving more interventions are doing much better in not having to sell off or not having an unplanned death of their animals, whereas those that were not receiving the multiple intervention packages were less successful. Next slide. So that's just giving you a little taste of some of the results that come out of these RMSs. If you're more interested, we can make sure that you have access to these longer reports, and there are briefs associated with these things as well. They all can be found on FSN website. So the next one I want to talk about is that second model that Jill talked about with regards to RMSs. This is an RMS that was set up in Bangladesh for the Shaharda 3 project. The idea here was to see if the project interventions were actually building resilience capacities and whether those resilience capacities were enabling households to manage shocks and stresses more effectively. Next slide. So this was implemented by CARE, and it was essentially a longitudinal study where we're using panel data over time. The purpose was to provide real-time information about the uptake of project activities, how those activities actually influence resilience capacities, and whether or not they enable people to maintain food security outcomes in the face of shocks. The main shocks that this area is exposed to are floods. Next slide, please. So we're trying to determine whether the program interventions are effectively contributing to resilience capacities so that we can inform program decisions and how to adjust interventions accordingly. So this was deliberately set up for adaptive management. We're trying to make sure that we're adjusting the program as we go so that people can actually be more successful in the interventions as they implement them. Next slide. we found that we're trying to capture why certain practices are being picked up and ones that are not. We're trying to also see if we need to change our strategy to increase adoption of new practices more effectively. We also were very interested in women's empowerment and how improvements in women's empowerment actually led to adoption of practices more quickly, or that they helped strengthen resilience capacities, and they had a positive effect on food security outcomes and recovery from shocks. Next slide. So in this case, we had 680 beneficiary households that were selected randomly from the Shahardo 3 MIS database. This panel was drawn from 2 sampling frames. One was the registered agricultural IGA activities, and the other was nutritional beneficiaries. First panel survey took place in July 2017, and there have been 4 rounds of follow-up monitoring every 6 months. So we're collecting data every 6 months in this RMS. Next slide, please. So in terms of some of the outcome indicators, what we're seeing is we're seeing positive effects of the project on improvements in household hunger. We're seeing positive effects in terms of the household and diet diversity. Next slide. We're seeing income actually starting to go up also for these households. Women's earning income was improving also. This women's empowerment focus has really made a difference. Next slide. The Women's Decision-Making Index, also we saw improvements over rounds. Next slide. And we also were very interested in these 3 types of resilience capacities: the absorptive capacities, the adaptive capacities, and transformative capacities. And we wanted to know whether or not, if we see improvements in these capacities, how did that affect these outcomes? So next slide. So what we're seeing is that we are positive. We're seeing positive changes in the absorptive capacity, adaptive capacity, and transformative capacity throughout the rounds. That means that the project is building these capacities over time. Next slide. Next slide, please. And we're also seeing improved agricultural practices and earning from production coming out of this as well. So it provides, this RMS not only allows us to see whether the project is having a positive effect, but at the same time during these 4 rounds, we had major flooding going on. And so even in the case of these households being exposed to floods, the interventions that were being implemented actually enabled them to manage those floods more effectively. And so what we're seeing is a positive gain from the interventions, and it's having a positive effect on people's resilience over time. Next slide. And that's it for that. So now I think we're willing to take some questions. Lynn, you want to take over?
Sure. So Tim, we have one clarifying question, and it's about the charts on the prime. And so it says that slopes for the high intensity treatment group seem to indicate that the worst shocks lead to better outcomes for this group. So can you?
Yeah, basically what that is saying is that what you're doing is you're modeling it, and as the shock intensity increases over time, people are actually doing better in terms of food security if they're in the high intensity group.
Okay, great. Thank you. Hopefully that clarified. There is a question for Jill as well. When you were doing your presentation, if you could describe the indicators that were used to identify positive resilience.
Sure. Thank you. So in the example of Pahal, we were looking at whether people were drawing on specific resilience strategies. So whether there were certain strategies the program was promoting and whether people were actually using them to to address those shocks and stresses, or when they're facing those shocks and stresses. And so an example would be reliance on kitchen gardens. So that was something that the program was promoting to increase the household food security. We wanted to see were people actually using them and continuing to use them even after the program interventions had ended. We also looked at whether people were relying and maintaining these multiple use water systems that exist at the community level. And then, like I said, I think I gave this example already, whether people were taking out loans from a formal source, so not from your local money lender that has high interest rates, whether they actually were using formal sources. So these were, in a sense, indicators of positive resilience, because they're the kind of the behaviors that we're looking for to see people are relying on when they're facing shocks and stresses. But we also look to see how it affected their well-being outcomes as well, mostly related to food security. And I would say we found less change there around food security, not because food security wasn't good. I think it was because the baseline levels of food security were actually quite good when we started, so we weren't able to see as much change. We did, though, kind of, I think the positive responses are a really good indication of whether people are initiating those strategies that you're promoting in the program. So hopefully that answers the question.
Thank you, Jill. Kind of going back to Tim, if you could talk a little bit about the difference between RMS and Rhema and the resilience, the measurement strategy.
Right. There is a paper that is going to be shared with everybody that just got finished, and it compares the resilience measurement approach that USAID has been promoting and the RMA. And what we found, RMA, we're comparing more the baseline end-line results of RMA with baseline end-line results of the studies that we've been doing. And what we found is that they are comparable in targeting the same households that are not resilient or ones that are more resilient. And so there's a lot of overlap in terms of agreeing on the same results. So that paper we'll be able to share. We'll put it out on the FSN network so people can have access to it.
And this question could be for Jill or Tim. So what happens when the shock trigger isn't clear? For example, perhaps food security and or rainfall are bad in some parts of the focus zone, but not others.
Yeah, I can take that one. That's Andre's question. Yeah, I think the example of the RMS that we set up in West Africa for Burkina and Niger fits that scenario where you don't have widespread covariant shocks across a large area, but you have a number of idiosyncratic shocks that are affecting individual households. I think the Pahal is another example of that. And I think what's good about this is that the RMS still allows you to see how people are managing stresses over time. And these stressors could be inflation, they could be just chronic poverty that is essentially preventing people from accumulating assets or getting out of food insecurity part of the year. So we can still track whether the interventions are making a difference and allowing people to manage those stressors over time.
Thank you. I have two questions for you, Jill, that may be related to the Pahal. So one is, how specifically did you link the financial data to the activity cost for Pahal? And then were there any differences in the results based on household characteristics? So female-headed households, caste, ethnicity, and the Pahal.
Okay, I'll try to answer this in a brief as possible. So luckily our evaluator is on the presentation. So I asked her to give me some details on the how she linked the cost data. And so Pahal had a pretty detailed costing system. And so it tracked exactly how much they were spending on each intervention. And so then what they did was that they averaged those across all households that receive the intervention to create a cost per household. And this was only really possible because of Bahal's detailed accounting system and their household ID beneficiary tracking system, like I said before. They then averaged overhead costs from management, M&E, et cetera, to all the interventions. And so that's sort of, I hope that's enough detail on that. And I think, again, if there's more interest in this, we will be publishing the evaluation very soon. That will give that more detailed information on how the financial analysis was done. But I think the two main points is that Bahal had a very detailed beneficiary tracking system and a mechanism for tracking costs. And those two things together allowed us to do the financial analysis. The second part of the question was about whether there were differences between these household characteristics. You know, I am trying to, I don't know if, I know that we looked at it, and I'm apologizing now for not having those exact details. But what I would say in general is that there's always going to be differences between different vulnerable groups in your population. And hopefully if you're able to explore, you know, the resilience for whom question, or if you have explicitly in your theory of change, that you would want to kind of, instead of just controlling for those differences, to then look and see how are they different. Because I think a lot of the management decisions that you can make are based on how your interventions are affecting different populations differently and who you're missing. And so I just got a message from our evaluator and saying that there were differences, but yes, so we controlled for those differences because we used this matching technique in our evaluation. And through the qualitative portion of the recurrent monitoring survey, we were able to dig into some of those differences in caste, specifically in Nepal that was the main sort of vulnerability criteria, or not criteria, but the ways in which we saw that the resilience for whom would be different for people that were of different caste groups. And so we tried to really dig in through the qualitative portion to see how it was different. But thank you for the question.
Thank you, Jill. So Tim, I'm going to combine two of these as well. So how did the program manage to manage the program intervention on the low intensity group so that they remain comparable till the end of the group? That's a great question. And also another question is, were all the households sampled implementing the concepts to the same degree? So could you test the value of the intervention in terms of resilience building? Or were there individual household differences in implementation that could mask the value of some of the concepts being promoted?
Okay, what we did was we used propensity score matching to try to identify the low intensity and high intensity groups. We wanted to match up on as many of the characteristics as we could to make sure that we were comparing the same things. And what even though we had designated areas that were supposed to be low intensity and high intensity, a lot of that designation kind of fell to the wayside because some places that were supposed to be high intensity, they couldn't work in because of conflict would break out. Other places, for other reasons, when it was designated low intensity, they decided to put more projects there. So we had to look at the whole population and redivide it up in terms of which households got low intensity interventions, which ones got high intensity, and then we used propensity score matching to make sure that we could compare those, and that's how we did it.
Okay, we have another question on sharing any tips that you all may have of convincing the mission to switch to a panel data collection for annual survey if we use the annual survey to report on outcome indicators. So they usually require a cross-sectional sample as a beneficiaries from 1 year, which might not entirely match the beneficiaries of the previous or following years. Or did you use with the RMS, did you use 2 different samples or one for the panel study or RMS and one for the outcome indicators measure. Sorry, I tried to summarize. I think I might.
I'm not sure I understand the question, but I think one of the advantages, if you build the RMS, or panel or longitudinal studies like these from the very beginning, is, and like Jill said, if you have a very good record of where people's interventions are taking place, and you even know how much money is going into those interventions, it allows you to really look at different combinations of interventions and their effect on people's resilience, and whether or not you're building these capacities and whether or not you actually are enabling people to manage these shocks and stresses more effectively. And so the advantage of that is we're always looking for what's the right combination of interventions that makes a difference. And this will allow you to do that. And so I believe, even though we spend a lot of money on these big surveys for baselines, midlines, and endlines, I think we could be a little bit more effective in providing information to the people that are actually implementing the program to make adaptive management choices if we have this panel data that's collected more regularly, that allows us to see how we're doing and keeps our pulse on the activities a little bit better. And so that's why I constantly encourage people to try to build this into their M&E system.
Yeah, and just sort of jumping off from what Tim's saying, I think that hopefully this guidance note will give you some ideas for how to communicate the value of recurrent monitoring systems so that you can communicate that to the mission or the AOR, and to kind of say, here's the value add of doing an RMS, and here's what a panel data approach could look like, and here's what it's going to give us. And I think that, like Tim said, sort of designing this from the very beginning is, it goes a long way with being able to sort of shift or convince people to do things a little bit differently. Sometimes, and I think you can also make the case that combining the surveys with your annual survey will save costs and make things a bit more efficient. So there's a couple of ways to sort of try to convince people to sort of shift the sampling strategy to sort of suit the information needs of a recurrent monitoring surveys. And I think the more that we do these and the more that we see, what information we're able to get out of them, the more that we're going to be able to sort of make that case.
I believe, do we have time for one more question, or do we need to? Thank you all so much for joining this webinar. Did not get answered. Please do know that we're doing a frequently asked questions that we will put on you see the websites here. All of the questions will be compiled together, and all of the consortium partners of REAL will be answering all of those questions. If your specific question today, it will be answered in the future. Also, please do the evaluation afterwards. Let us know what you thought. And thank you again for all of the questions and engagement with this webinar.
Yes, thank you everyone for joining.
Yeah, thank you.
Thank you. Thank you, Lynn, Tim, and Jill so much. The evaluation link is in the chat box, and we will send out the presentation and recording to all participants later on today. Thank you.
Thank you.